Hi, I'm Andrew with Vata, and today I want to go over one of our new products. This is our wearable 2-vein IV access trainer. This product takes some of the features from our other products, such as our advanced venipuncture training aid, and adds an additional level of learning to it. Since it's a wearable, I can put it on myself. I can now become the patient, and this encourages the students to have to interact with an actual person, ask them questions, talk about how their day's going. If they're nervous, how do you calm them down and make them more comfortable? This adds that extra layer of realism, which is going to be extremely beneficial to their learning experience. So today I want to go over a few different things. The first thing is we're going to open up the box. We're going to show you what comes with the product when you purchase it. Then we're going to put the product on, show you how to set it up. We're going to show you how to put the product away, drain the model, get it back in the box. We're also going to show you how you can access it. And then we're going to go over a few of the different questions we're going to get about the use and care of the product. When you open up the box, you're going to see a few different items in here. The first one is going to be our user manual. This is going to go over basically what we're going to do in this video, how to set the product up, how to put the product away, care and use questions on the product. We're also going to have a small thing of baby powder. This is going to be used for both a lubricant to help get the sleeve on and off as a dry lubricant, and it's also going to be used in the care of the skin pad itself. The next thing we're going to have here is going to be our fluid bag with an armband. And then lastly, we're going to have our skin pad with the sleeve. With all these products out, you're now ready to actually put the product on. So when you're going to be using the product, this is going to be the main part of it. This is going to be our sleeve with the skin pad and the veins underneath it. You want to open that up and just get yourself acquainted what's in here. This is going to be our skin pad. It's going to have two different veins, a smaller or a medium tube here, and then a larger tube on this side. This is the lightly pigmented skin. This is going to be our 1010 model. It also is going to come in a darker skin tone. This is going to be our 1011 model. The only difference on here is going to be that skin tone. Both models are going to set up and be used the exact same way. So now that we have everything out, let's go ahead and put the model on. First step you're going to want to do is put your arm into the sleeve. There's a Velcro strap here. We can just loosen that. Slide your arm in, and you're going to want to get this high up on your bicep. Take the strap here, tighten it down so that it's nice and snug and it's not going to slide down your arm at all. When you do this, obviously you're going to want the tubing here, the stopcock and the bubble trap. You're going to want those connections down towards your elbow area. The next thing you're going to do is put on the skin pad itself and the sleeve. Again, this part here is going to go down towards your wrist. The tubes we want to exit again up towards our elbow area. So put your arm in, slide it around. If there's not enough powder in there and it doesn't slide right onto your arm, sprinkle a little bit of powder on the inside of the sleeve. That's going to really help it slide onto your arm much, much easier. With this material here, it's very stretchy, so pull it up there. It's going to fit on your arm. Yeah, it's got a wide range of use there. Once it's on your arm, you're going to want to start to attach the tubing. So again, you're going to be a medium tube here. This tube is going to screw onto the stopcock. So you're just going to go on, give it a quick turn. With the larger tube here, that's going to screw onto this bubble trap. So again, just put it in there and give it a turn. If either one of the bubble trap or the stopcock come out, they snap right back into the features on the arm bag holder there. Once everything is attached, you're now ready to prime it and get fluid into the model. So to do that, first step is going to be to remove the cap off of the bubble trap and then turn the stopcock. If fluid doesn't start coming out right away, just like with our advanced venipuncture model, you're just going to want to give it a quick squeeze, and then fluid's going to go through all the vessels and it's going to come up into this bubble trap. When you see the fluid up here, that means all of the fluids come through the arm and also that all the air has been pushed out of there. After that's done, you're going to want to take the cap and place that back onto the bubble trap. This is going to help, as this is a wearable. You want somebody to be able to move their arms around as they're the patient, whether it's just talking or them laying in the bed, and having the cap on there is going to prevent any of the fluid from potentially leaking out onto the person or onto the training environment. Now that it's ready to be used, you can go ahead and access this. Again, this allows the learner to actually talk to the patient, to the person wearing it. This allows them to put a tourniquet on. This allows them to move the arm around and position it in the correct location and orientation for them to get a successful access into those vessels in the arm. Now that you have the model on your arm, it's set up, primed, and ready to be used, you can bring in the learner, and the learner is able to practice placing that IV catheter. For them to do that, what's nice is they're able to talk to the patient or the person wearing the model. They're also able to position their hand wherever they need it to be for optimal success. They can go ahead, they can palpate, and then they can access the vessels. When they access, if they access correctly, they will get a confirmation via a blood return or a flashback in the needle. They can remove the needle, and if any fluid is on the surface of the skin, it can be simply wiped off, and that little drop's all that's gonna come out. After they're done, they can either repeat that training as many times as needed, or you can move on to your next learner. After we've completed our accessing, what we're gonna wanna do is we're gonna wanna drain the fluid out and get the model ready to be put away. So to do that, you are going to remove the bubble trap, place that into your other hand, and then you're gonna actually wanna just remove the cap. If we raise that up, then you're gonna see the fluid start to drain out. The fluid's gonna be pulled down by gravity back into the fluid bag. And in anywhere from 20 to 30 seconds or so, this should go clear, or you should notice that fluid's no longer draining down into it. And at that point, the model is gonna be completely drained of fluid. So once it's completely drained, then we're gonna close that stopcock out. We're gonna put the cap back onto the bubble trap and place that bubble trap back into the holder here. You're gonna wanna remove the connector from the bubble trap. And then you're gonna wanna do the same thing on the stopcock. After both of those are disconnected, you can pull the arm sleeve off of your arm and then loosen the strap and pull the blood bag holder off as well. Put those both down on your table, and the model is now almost ready to be stored. If you are gonna be storing it for more than a couple of weeks, you're really gonna wanna do some care to the model to extend the life and prevent any mold growth. So the first thing you're gonna wanna do is take the skin pad with the sleeve, and you're gonna wanna flush the tubing with distilled water or a saline solution. Push it all the way through using a syringe, and that's gonna basically wash out any fluid left from the training, and it's gonna leave everything inside clear. After you've done this, you're gonna wanna leave the model out with nothing on the end of the tubes to allow air to circulate through and allow those tubes to dry out. After that's done, you can go ahead and store it. Again, that should only need to be overnight. With the fluid bag, it's okay to leave the fluid in here. I would say the one exception is gonna be is if you are gonna be storing the model for longer than a month or 2 months. In that case here, you are gonna wanna go through and probably drain this fluid bag. Give it a quick rinse out. Again, you can use the stopcock here or the needleless connector to flush saline or distilled water through it. Leave it clean, leave the stopcock open, allow it to dry out, and that is gonna be the best way to store it. When you do go to store it, after you have rinsed it out, you are gonna wanna place the cover back on. This skin, while it is really soft and it accepts needle sticks extremely well, it is soft, and that is gonna mean that it's gonna leave an imprint in, or it can have an imprint left in it if anything is placed against it. So having this cover on is gonna protect that skin. After you've done this, you're great to store the model. Some of the other things as far as care are gonna be the skin pad itself. At the beginning, I mentioned that the powder is gonna be great for a lubricant inside the sleeve. It also does an amazing job on the skin, maintaining a nice soft feel, as well as preventing dirt to adhere to the model. If or when this does get dirty, the best thing to do is gonna be to just clean it with soap and water or isopropyl alcohol. Give it a good wipe down, use soap and water. Either method will allow the skin to dry completely. That's gonna be really important. After it's dried completely, sprinkle a little bit of the baby powder on it, wipe it off with a clean, dry cloth, and then it is ready to be stored. With this model, some of the questions that we're gonna get, and there are questions that we get on models that are similar to this, is how many needle sticks can I use? Is it gonna show track marks? Those types of things are really common. So with this material, the first thing I would say is no, track marks are not gonna be seen on the skin. This skin does a great job of healing after it's been accessed. On the model though, we do recommend using a 20 gauge catheter or smaller. If you do want to use something larger than that, you can do it, but it is going to reduce the life of the model. The other thing is with the track marks, it's not gonna leave those, and what that's gonna do is that's gonna allow you to get a lot of usage out of this. Our estimates and in our testing, we found that you can get around 1,800 accesses with a 20 gauge needle or smaller in this model before it needs to be replaced. So that's gonna get you a lot of use and a lot of users through using this model, which is gonna be great for you. On this, the product has replacement parts or parts that are gonna go bad. So when something does break or go bad, let us know. We do sell those parts, so there are ways to get those parts back and get your model up and running. If you should have any questions on this model, feel free to reach out. We're gonna put our contact info at the end of this video, and we look forward to hearing from you. Thank you very much.